In today's video, I am going to identify the 5 essential care habits that you absolutely need to maintain for your penis to guarantee long-term quality and efficient sexual health. I am going to summarize this in a way that is comprehensive, yet quick and straightforward. And make sure you stay until the very end, because I'm going to share a 6th bonus care tip that I am certain very few people know about, a tip that could save you from chronic issues down the road. These 5 care tips we are going to identify are the ones that every man must adhere to regarding his sexual health to avoid serious complications. We are talking about avoiding STIs or sexually transmitted infections. We are talking about preventing penile cancer, which is a devastating, mutilating disease associated primarily with poor local hygiene. We are also looking to prevent penile tortuosity, better known as Peyronie's disease, and erectile dysfunction, ensuring you maintain an efficient sexual function throughout your life. Let's get right into it. What are the 5 essential care tips every man needs? The first essential care tip involves the mechanics of intercourse. You need to pay very close attention to the practice of sexual relations when the penis is in a semi-erect state. This refers to that state where the erection is not fully rigid. The penis is partially erect and partially flaccid. This is critical because, in this state, the penis is mechanically unstable. During intercourse, there is a tendency for repetitive movements and pressure against the partner's body, specifically the perineum. If the penis is not fully rigid, it is prone to buckling. When the penis buckles or bends under pressure during thrusting, it causes microtraumas inside the distinct chambers of the penis, specifically to the tunica albuginea. The tunica albuginea is the tough fibrous layer that encases the erection chambers. When you buckle the penis, you create tiny tears or injuries in this layer. Over time, as these microtraumas attempt to heal, they can facilitate the formation of local fibrosis. These are essentially internal scars or micronodules. As time passes, these micronodules can calcify and form hard plaques. These plaques are the root cause of penile tortuosity, known as Peyronie's disease. Peyronie's is an acquired curvature of the penis that develops over time, associated with these fibrous plaques. It can make erections painful, cause significant shortening of the genital organ, and make penetration difficult or even impossible. Therefore, if your penis is not fully erect, or if you lose turgidity and firmness rapidly during the act, do not try to force penetration. It is safer to stop. If this is a recurring issue, you need to find a professional, talk about this problem, and treat the underlying erectile dysfunction. Treating the ED is far better than forcing the situation and causing structural damage that leads to major complications in the future. The second essential care tip is the concept of use it or lose it. You must keep your penis active to avoid disuse and penile atrophy. The penis, much like any other organ in our body, requires constant stimulation and oxygenation to remain healthy. Think of it like your brain, your legs, or your arms. The more activity and stimulation they receive, the better their performance and longevity. For the penis, this means oxygenation. When you have an erection, the tissues are flooded with oxygen-rich blood. This oxygenation is vital for the health of the cavernous tissues. This is why the body naturally induces erections during sleep, the so-called nocturnal erections. These are involuntary maintenance mechanisms to keep the tissue healthy. Therefore, it is very important to have a healthy, active sex life. It is important to pay attention to those spontaneous erections that oxygenate the penis during the night. However, rest assured, if you do not currently fit the profile of having a highly active sexual life with a partner, you can utilize other methods to maintain this health. You can use pelvic floor exercises, such as Kegel exercises, which activate the local musculature and improve blood flow and irrigation to the area. Additionally, some modalities of pelvic floor physiotherapy can be incredibly beneficial. For example, the use of vacuum erection devices, commonly known as penis pumps. This is vacuum therapy. It isn't just a toy, it is a therapeutic tool that draws blood into the penis, keeping the tissues active and oxygenated. Some medical protocols suggest using vacuum pumps for about 30 minutes, 3 times a week, to prevent atrophy and maintain size and health. This can be indicated and guided by a qualified professional, such as a pelvic floor physical therapist. However, while exercises and devices are great for maintenance, many men are looking to address the root cause of weak blood flow from the inside out without relying on pumps or risky medications. There is actually a bizarrely simple 7-second daily habit, often described as a purple tonic, that is helping thousands of men naturally deactivate the biological enzyme responsible for killing erections. It restores rock-hard firmness and stamina rapidly, regardless of age. If you want to see exactly how this natural home remedy works, take out your phone and scan the QR code appearing on your screen right now. It will take you to a short video that explains everything. I have also pinned the link to that video in the top comment below. I highly recommend you check that out. Now, with your blood flow strategy in place, let's protect the exterior. Moving on to the third essential care tip, intimate genital hygiene. This might sound obvious to many of you, but we need to explain the ideal way to do it and the severe risks inherent to poor hygiene. It is a startling fact that in many parts of the world, we see high incidence rates of penile cancer. Penile cancer is a mutilating, traumatic disease that often requires amputation. It is directly associated with risk factors like poor local hygiene and a promiscuous sexual life, which increases the risk of infections like HPV. It is absolutely vital that the sanitization of the penis is performed 1 to 2 times per day. The most critical part of this process is the total exposure of the glands. You must retract the foreskin completely to clean the area. Regarding the soap you use, opt for a neutral soap, like a glycerin-based soap or a simple bar soap. Do not use those heavily perfumed soaps or shower gels full of strong chemicals that you buy at supermarkets or pharmacies. These products can alter the local pH balance of the skin, leading to irritation or fungal growth. Stick to neutral options. A very specific pro tip here: wash with the foam, not the bar. Avoid direct contact of the chemical substance or the rough bar against the glands, which is a mucous membrane. Lather the soap in the palm of your hand to create a foam, and then apply that foam to the penis to begin sanitization. Another crucial observation regarding hygiene is moisture control. After washing, you must dry the penis thoroughly. You can do this with a clean bath towel or with toilet paper. It is essential that there are no droplets of water or moisture remaining before you pull the foreskin back over the glands. If you are uncircumcised, meaning you still have your foreskin, this is even more important. If you have difficulty exposing the glands, or if there is a tight ring of skin preventing you from pulling it back fully, you may have true phimosis. If this ring prevents proper hygiene, you must see a urologist. In these cases, a postectomy or circumcision may be indicated to correct the phimosis. This surgery facilitates hygiene and prevents the accumulation of smegma. Smegma is that whitish secretion that accumulates under the foreskin. It is a breeding ground for fungi and bacteria and is a known risk factor for chronic inflammation and preneoplastic lesions that can turn into cancer. Furthermore, develop the habit of drying the tip of the penis after urinating. If droplets of urine remain, dry them with paper to keep the region dry and away from humidity. And finally, regarding hygiene, we must talk about cleaning up after sexual intercourse. The vaginal pH is different from the penile pH. Therefore, the bacterial flora is different. A man needs to sanitize his penis after intercourse to avoid the development of fungi, bacteria, and candidiasis. Leaving fluids on the skin can cause irritation and changes to the skin's integrity. The fourth essential care tip revolves to your accumulated lifestyle habits. You should opt for a healthy lifestyle because the health of your penis is a reflection of your systemic health. You need to control comorbidities. If you have diabetes, high blood pressure, or dyslipidemia, high cholesterol, these must be managed strictly. You must maintain an ideal weight and combat obesity. The penis is heavily reliant on your vascular system. If your blood vessels are clogged or damaged due to poor diet and weight, blood cannot flow effectively to the penis. And we must talk about vices. You need to control alcohol consumption and, most importantly, eliminate smoking. Tobacco use is a massive risk factor for infertility and, significantly, for Peyronie's disease. Smoking impairs the body's ability to heal and oxygenate tissues, making those microtraumas we discussed earlier much more likely to turn into permanent scar tissue. The quality of your sexual health is directly proportional to your healthy habits and inversely proportional to the bad habits you accumulate over your lifetime. The fifth essential care tip you need is to avoid the consumption of pornography and the practice of excessive masturbation. There is a growing body of evidence regarding the effects of pornography and masturbation, particularly on the brain and sexual function. The continuous practice of these acts desensitizes the patient regarding sexual stimuli. When you constantly consume pornography and masturbate, you are flooding your brain with dopamine, a neurotransmitter associated with pleasure, in an unnatural way. Over time, this leads to a dopaminergic desensitization. Essentially, your brain starts to require larger, more intense, and more varied stimuli just to activate the reward pathway and reach the desired pleasure. Real life and a real partner often cannot compete with this super stimulus of the screen. Furthermore, this creates a physical issue often called death grip. The force and intensity with which a man manipulates himself during masturbation is often far greater than what is physically possible during vaginal or anal intercourse. The friction and pressure are not replicable in a real sexual situation. This leads to significant sexual dysfunctions. We see patients suffering from delayed ejaculation or anorgasmia, where they cannot reach orgasm with a partner because the physical sensation is not intense enough compared to their hand. We also see hypoactive sexual desire, where the libido drops because the brain is wired for the screen, not for a person. It is very important that these habits are curbed and controlled so that you can improve the quality of your real-life sexual experiences. And now, for those of you who stayed until the end, here is the sixth bonus tip. This is a simple lifestyle change that I am sure very few people think about. Create the habit of sleeping without underwear, or at the very least, wearing very loose boxers. This is to avoid the friction and restriction of the penis against tight underwear during the night. As I mentioned, spontaneous nocturnal and morning erections are involuntary. They are the most physiological erections you have, indicating good vascular and hormonal health. It is normal and healthy for a man to have them. However, if you wear brief-style underwear or tight fabrics to sleep, these erections have nowhere to go. The penis expands against the resistance of the fabric. This causes the penis to be compressed, bent, or trapped in an awkward position for hours. This resistance creates friction and, more dangerously, mechanical trauma. Just like with the semi-erect sex we discussed in tip number 1, these nocturnal restrictions cause microtraumas to the shaft. Over the long term, we are talking years of sleeping this way. This can contribute to the formation of local fibrosis and calcified plaques. Yes, tight underwear at night can be a contributing factor to penile tortuosity and Peyronie's disease. By sleeping naked or with loose clothing, you allow these natural maintenance erections to occur without restriction, keeping the anatomy of the penis safe.